Hi, my name is Renee Lamp. I'm one of the certified school nurses here at Manheim Township School District. I'd like to take a few minutes to share with you some tips on preventing or reducing the risk of transmission of germs and viruses when you cough or sneeze. This is what we refer to as cough and sneeze etiquette.
COVID-19 is mostly spread by respiratory droplets released when people talk, cough, sneeze, shout, chant, or sing. It is thought that the virus may spread to hands from a contaminated surface and then to the nose or mouth, causing infection. Therefore, personal prevention practices and environmental cleaning and disinfection are very important. Personal prevention starts with frequent and thorough hand washing. It also includes staying 6 feet apart from those people who are not in your household. Avoid touching your eyes, your nose, and your mouth, and learn how to remove your mask and care for it properly. When you cough or sneeze, cover your mouth and nose with a tissue and throw your used tissues in the trash. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Of course, masks should always be worn in public settings and when around people who don't live in your household, and when 6 feet of social distancing is difficult to maintain. However, covering your cough and sneezes remains important whether wearing a mask or not. For an amusing look at proper cough and sneeze etiquette, take a few minutes to view the video, "Why Don't We Do It in Our Sleeves?" It is sure to make you laugh. For information about preventing the spread of COVID-19, see the CDC's COVID-19 Prevent Getting Sick webpage. Stay well and stay safe.